Welcome to HoneyChildListen, where the mic becomes a mirror and every story matters. I am Katrina, your host, and this isn't just another podcast. This is the living room, the kitchen table, the sacred circle of good girlfriends coming together to sip and spill the tea on life, love, legacy, and everything in between. So grab your glass, get cozy and comfortable. You're with your good girlfriends now. And don't forget, we want to hear from you. Got a story, a question, or some tea you need to spill? Go to HoneyChildListen.com and drop a message in our inbox. Be a part of the conversation. We want to hear from you, the community. This is Honey Child Listen. Let's have some fun.
Good afternoon, everyone, and welcome to Honey Child Listen. I am Dr. Alina Mayo Mills, the owner of Valley Health, and a concierge business here in DC and Maryland. And we are here today discussing healing together, hurting alone. And today we have four wonderful panelists, and I will allow them to introduce themselves.
Hello, I am Corey Walker-Bell. I am a property manager during the day. At night, I am an artist. My name is J11, and I specialize in R&B music.
And over here to the far right, if you could introduce yourself.
Hello guys, my name is Chrissy. I am an entrepreneur, a graphic designer, and I'm also a mental health advocate for at-risk youth.
I'm Dr. Roderick I. Wellington, mental health clinician with over 30 years of experience in the mental health arena, specializing in family therapy and veterans and youth. Also adjunct professor at Bowie State University, teaching the master's program in mental health counseling, and also works with the Commissioner Board for the state of Maryland as well. It's a pleasure to be here today.
Great, thank you guys. Thank you everyone for being here on this beautiful day, summer day. I thank you for taking your time out to come and spend some time with us and help to possibly educate, and maybe someone can find some information that we share today that will help them along their journey. First of all, I'd like to say happy Men's Mental Health Month. June is Men's Mental Health Month, where we really target the stigma and decreasing stigmas and improving access for mental health for our men out here. So I'm glad that we're doing this the last couple days of June. We got it in. I like that. Our topic is healing together and hurting alone. So we're going to start off with the first question. Who have you lost that has deeply impacted you? And how did you experience that grief? Who would like to start?
I'll start.
Okay.
For me, it was my father. I lost my father in 2018. How I dealt with it, I don't think that I fully have, honestly speaking. I think it's more of a just keep moving forward and trying to avoid dealing with it. It varies day to day for me.
Okay. Then why do you say you don't think you've dealt with it?
I think during the midst when he passed, I was trying to be strong for everyone around me. My sister, my brothers, my aunts, uncles, and I didn't really allow myself to grieve and feel that pain. I feel like I did it for maybe a split second. Then I jumped into, okay, let's figure this out. We got to plan the funeral. We got to get all these things together in a short amount of time. So I don't think that with me doing that, I allowed myself the grace to grieve.
Okay, so you know that grieving is there's no time limit on grieving.
Absolutely.
Let me say that before I move
absolutely.
on. Chrissy, would you like to share?
With the same
question.
also?
Mm-hmm.
Well, we share the same father.
We do.
So I would say that's one of the losses as well that impacted me. And what was the second question?
How did you experience the grief?
I think that I learned, that was my first experience with grieving. And I think that it was something that it was constant, but it was just like a different experience as far as it's always different. Every day is different. And some days you're happy, some days you're not. But it was definitely a learning experience. And I would say also I'm still learning. The process is not over.
Thank you. So before I let our expert say a couple words, because I know he knows all this. You know, there are stages to grieving, right? And the stages to grieving are denial, anger, bargaining, depression, and acceptance. And these stages of grieving, you can experience this on a spectrum and out of order forever, right? It doesn't have, there's not a 3 months, 6 months, 2 years, 6 years process. So when you say that you had a fluctuation or different emotions at different times, that is absolutely a normal process of grieving, okay? Dr. Wellington, this is your area of expertise.
Not only is it my area of expertise, but as you mentioned, the pros and cons of coming from a large family. I'm one of 12 individuals. I'm the youngest child of 12, 8 boys and 4 girls. And just last week, a couple of days ago, one of my nieces posed a question to me. She said, "Unc, how do you deal with things?" She said, "People are coming to you so I can express to them about death and dying, but I'm also human as well." Yeah. And the pros and cons is, being the youngest, hypothetically, of course, I'm supposed to be the last, but that's not always the way it's going to happen. But I've lost my parents, I've lost 5 siblings, and I've lost grandparents. So death has started at a very young age for me, probably around the age of 8, I believe, when I remember losing my first set of grandparents. And throughout my history, I've lost some form. And then when I come into the expertise of it, I'm dealing with clients on a regular basis that's losing individuals within their family. So one, how do I deal with it personally, and how do I deal with it professionally? And as the great doctor just said, there's 5 stages of death and dying. And I used to teach a class at Prince George's Hospital on death and dying. And one of the main things I think we as human beings, we say it all the time, but we have to realize it and face reality that life is a part of death.
Yes, it is. Yes, it is. So, which brings me, that's just a great segue into the next question, right? What helped you cope? What helped you cope with the day, during those days and weeks, not just pinpointing one specific situation, because you've had a process, right? What helped you cope with the death and grieving?
Sure, thank you. And I think, as I mentioned, this is before mental health. Before I even thought about becoming a mental health clinician, at 8 years old, I had the great supportive family. Having 8 brothers and 4 sisters, I used to tell people I had 8 fathers and 5 sisters. So being the youngest, I had that support system. We all need a support system. And to be able to bounce back for your older brothers and say, "Oh, you're going to be okay." You know, I had them to come to and talk to. I had my sisters. And at that time, my parents were still living as well. So I had a system to be able to learn what death meant, why death happens. So I think that was great for me.
What about you, Chrissy?
How did I cope? I would just say staying busy. I started my job the day after my dad's funeral, so just staying busy and being productive, and also leaning on family as well, and particularly my mother. So I would just say keeping myself busy.
What about you?
Honestly speaking, initially it was alcohol.
Thank you, because I was going to get into some.
I'm an honest person, so it was alcohol for me at first, because to me it took the pain of losing my father away that I never even thought I would have, and that didn't pan out as well as it may seem. So then I just put myself into work. I actually started my father's death brought about my music career, because that was where I found my escape, just writing and creating music, and that just blossomed into what it is today for me.
Kind of like journaling.
Yeah.
Your pains. I think that's amazing. Dr. Wellington, I want you to jump in here because I'm hearing something, and this too. So I lost my husband in 2010. Unexpectedly. It was 9 weeks from death to diagnosis, and we had just had a 5-month-old baby. So I get this, right? So what I heard Chrissy say is exactly, well, not in that time. When I lost my mother, let me go back. I lost my mom right after 9/11. And what I did with my mother was I stayed busy. I stayed busy, and I didn't fully want to deal with the process of grieving, right? I didn't want to accept it. I wanted to deal with it as I could handle it, as what I thought. So I know that. Is that a good way? So when I hear I dove myself into work, to me it's kind of avoidance. Am I avoiding if that's what I'm doing to keep myself busy and occupied so I don't have to think about it? Because what I learned was there was someone that never spoke of a death, and it was a significant person that passed. And I took it that they were doing very well coping. But what I learned was they were not. Because to never speak of someone that is so significant to you means that you're constantly thinking, not to mention the person.
Just like you spoke earlier, you talked about the 5 stages. So what you both were dealing with was denial.
Oh, yeah.
You know, this person was healthy, you know, they're not gone, you know. And sometimes it hits us 6 months later, 6 years later. We can be driving down the driveway or driving through the highway, through 495, and a certain record comes on, or you smell something that resembles your father or your mother or your husband maybe, and it hits you, wow. And you deal with it all of a sudden, right then and there. But it's a denial from the first time because it was unexpected. And those are sometimes the 2 types of deaths we deal with. Unexpected death when it just hits you, or you've had a family member that's been dealing with cancer for the last 6 months or a year. You're able to deal with that even more. You can deal with it even better. Right. But when it's sudden deaths, that's a little more difficult, and so it's more denial. With the cancer or any other sickness, you're able to process it more, and you have time to process it. But when a person getting run over by a car in a car accident, those are sudden deaths. We didn't know that was going to happen. So you're dealing with that first stage, and that's the denial process.
What's your recommendation for therapy for those? I mean, because we have people that really, we've learned to cope with things and keep it in the family, and that's not always the best thing to do. So what is your recommendation what would you recommend?
I recommend therapy for everyone.
Immediately.
Not just
Prior to this, right?
Not just for death and dying, but
Yes.
just as a regular maintenance. We go to
Yes.
therapy. Sometimes, of course, we're in a crisis and we want to seek therapy. Go to the pastor, as we say before, or go to Jesus before. We're having a Jesus moment. Don't wait till the Jesus moment to happen. Go to Jesus before time.
Absolutely.
And the same thing, concept with the therapist. We go to our primary, I heard someone talk about their primary physician earlier today. We go to our primary physician, at least once a year, sometimes twice a year. Why not go to your therapist as the same thing? So when that time comes, when you're dealing with the death or crisis, you've already in therapy. So go out and seek your therapist right away. After you leave this broadcast, go and get your therapist.
No, I'm telling you, I so agree with you to have a therapist on deck, and that's what I say. Therapy on deck, it's always good to have a professional that is non-biased, that's educated, that has tools and training to see past your statements and really know what the intention is. Because I can make some statements and they're like, let me see here. So I think that therapy is wonderful. My therapist became my job right after my husband passed away. Instead of going back to work because I just had a baby, I was there 3 to 4 days a week until he started cutting my stuff down. He was like, okay, 2 days a week. Okay, 2 days every other week. Okay, and I was like, oh, he's trying to get rid of me. But no, still around, absolutely amazing. It was truly a blessing to start therapy then. And since then, I have been a huge promoter of finding someone you like. Please don't give up the first time, because you may meet someone that you don't bond with. You know, everything is not for everyone, right? Every person isn't for everyone. But don't give up. There is a therapist out there for you that you can bond with, that can help you think a little bit more, I don't want to say clearly, but put things in a different perspective. Mm-hmm. Thank you, guys. Okay, so did you notice any mental, and I'll start with you, Corey, did you notice any physical or mental changes as you processed your grief?
Oh, absolutely. I gained weight. I would look at myself in the mirror and just see this sad individual that I didn't recognize. Even sometimes in present day, I still go through that because, like you said, grieving is never over. People say, oh, time. No, the time is not there. Yeah, I may feel better in time, but I'm always going to grieve, especially that being my parent. I'm always going to grieve that. So for me, it was the weight gain. It was the not recognizing myself when I looked in the mirror. It was people telling me, you don't look like yourself. You're not acting like yourself. And I mean, I did some of the work. I mean, I'm still doing it, but I did it to kind of get back to me, because I know that my father would have not wanted me to go through that, would not want me to sit in that. So I take that and say, okay, well, now I got to get up and pull myself back together. I got to figure out what that means and how to do it. But that was the first step, just figuring out how to pull myself back together.
What was the aha moment for you? Meaning, like you tried the alcohol, you're gaining weight, you're not in your positive, high frequency space, right?
Mm-hmm.
So do you remember like a aha moment where you said, mm-mm?
The
Was it one of those?
moment for me was when I got in trouble. Because of the alcohol, I went out one particular day. This was back in 2019. My father had passed in November of 2018. So I was still dealing with it. And I didn't even recognize all of what I was dealing with at that time. So I remember the day clearly. I got really drunk, didn't eat any food, went out with some friends, and within that got into a physical altercation where I ended up arrested and ended up in court the whole entire summer. And that's when I was like, this isn't healthy for me. This is taking me down a road that I don't want to be on.
Right.
And that was my aha moment. Like, you can't keep doing this. This cannot keep being your outcome for your grief. You got to find healthier ways to navigate through that.
Can you think and say, hey, if I would have had intervention at this particular point, that wouldn't have happened, or you feel that was going to be
I feel like it needed to happen.
Okay.
Yeah, I feel
so,
like
because I know your mom.
Yeah.
Okay. So I'm saying, like,
No, and
I know the resources are there, right?
So I have my family around, friends around, like everyone's trying to make me feel better. But
I got you.
It's something you have to go through individually. You can't expect anyone to go through it for you, or even understand what it is that is going on within your body, your mind, your spirit, your soul, what you're feeling, how it's actually affecting you. So I have the people around me. I just chose the alcohol and the party, and it didn't pan out for me. Luckily, the situation, got dismissed and everything, but that was my wake-up call. Corey, you cannot keep doing this if you want to do that.
What about you, Chrissy? Did you recognize any mental or physical changes?
Yes, I would say I did. Physically, on the opposite, I lost weight initially. I lost about 20 pounds. When it first happened, just in a whole couple of months of everything, when the realization starts sitting in. So I lost weight, and mentally, I would just say I think that's when I developed anxiety issues and stuff like that. Not wanting to I would say not even wanting to be close to people because of the fear of losing them. So I developed a lot of mental different. I wouldn't say, what's the word?
Avoidance?
Yeah, I was avoiding people, but mental disorder. I wouldn't even call it a disorder, but I had a lot of mental challenges and changes that I still deal with.
You're in therapy? Do you have a therapist?
No, I'm not in therapy.
Oh, Dr. Wellington.
Dr. R. Wellington.
That's what I said. Oh, Dr. Wellington.
No, I think going back to both Christy and Corey, I think Corey was dealing with anger and depression at the same time when he was dealing with that. And we talk about the 5 stages, and they don't have to come in that order. Mm-hmm. They can come in any order. They can be out of order, but you're going to deal with them, with the anger that your father died, and what I'll do, I'm going to lash out at someone else, misplaced anger, the depression for losing the weight because you don't want to eat, you don't want to get out of bed. So these are all the symptoms that we go through with death and dying, I think. And having that support system again, to go back to talk to somebody, whether it's your mother, or both of you bouncing off of each other. But I talk about therapy it's about talking to someone. That's the whole thing. That's what I do. I get paid to listen to people, talk. And that's what you need, a catharsis of getting it out. That's the whole concept of therapy, to expressing your feelings so you can move on with it.
And I think for me, I didn't want to talk because I didn't want it to be real. Mm-hmm. So the less I talked, the less real it felt.
Yeah.
And that's just, I think that's what I went through. denying it because, one, I never thought my father would die at 49. Never even thought it. You know, he was, to me, he seemed healthy and able. So I just never thought that at 49, my dad would pass and that I would have to deal with that. Like, you know, you think when your parents die is going to be when they're older.
Right.
Like when they've lived life. I feel like my father was just starting to live his life, and that happened, and it was just like, I just couldn't deal with that.
And that was the acceptance part of it. That was the last stage of death and dying, is accepting it, where the client or the person that's dying, because death and dying, the 5 stages, the individuals who die, they have to go through these stages as well.
Yeah.
And to be able to accept it, it says the patient reaches, or the person reaches acceptance that this person is inevitable, he is going to leave us.
And I think also it felt like I didn't get to say goodbye. Like I didn't get those last moments with my father, because by the time I made it to the hospital, he was already in a coma.
Wow.
So it was like I didn't even get to say my last words to him. And it's things that I wish I could say to him now, but I don't have the opportunity to say it to him. And it definitely still affects me to this day.
But you can, and that's one of the things, the processes we do in therapy, we call it the empty chair, Cole. So you still can go and talk to your father. You know, be in the silence of your home one day or in the car, you know, and imagine that your father is right there, and let him know what you feel or what you wanted to say to him that you didn't get to say to him. And that's, again, the process of you getting it out. Whether, you know, what you believe in, what your religious faith might be, but you're getting it out that, hey, Dad, this is what, you know, I didn't get a chance to say to you. I want to say it to you now. So try it.
So that's great. Once again, you segue into our next question. What role did family, and I think we've kind of heard that, right? What role did family, faith, and culture play through your grieving process?
Faith was shaking. Definitely shaking. I have a really close relationship with God. So for me, in that moment, it was like, why did you take him from me? Who do I have to go to? Now, granted, me and my father may not have had the best relationship, but it just felt like a death that I can't even explain. I can't even put it into words what I went through when it came to my faith. But, you know, I come back around, you go through those stages, and I just got back close with God, and family was a big part of me realizing that I wasn't alone in it. Because I have my sister, my brother, who also was experiencing the same thing. And even though I felt like I was alone in it, having them, I also felt like I wasn't alone in it. And that was kind of that saving grace that pulled me out of that dark place that I was in, to know that I wasn't experiencing losing my father alone.
What about you? You felt the same?
I say with family, they just give you like purpose to find more reasons to continue to enjoy life. And as far as the faith, I would say I got closer to God because when nobody else had the answers, that's who I felt had the answers for me. As far as just seeing, still having opportunities come my way, still having different good things happen to me in the midst of a bad thing, made me feel closer and try to explore my faith more. Because I was realizing that good things can still happen during a bad time. And that sometimes losses come with good things. So I feel like I got closer with the faith.
I think for me, the loss of my mom, she was 48 years old, right? And she died in her sleep. But she lived a very risky lifestyle. My mom was for them streets.
Okay.
She was fine. So with hers, I was 29, 30 years old. So I think I was still kind of, the anxiety of me getting older and having foundation, but then still feeling a little immortal, right? Like, I'm in my 20s. That's what kind of hit me, right? She's 48, and then me thinking about that. So when I turned 48, the anxiety that I had, and I was like, ooh, I still feel like I'm 23. Like, this is how she felt also, right? So dealing with her death was a little different, right? I dove into work. I kind of lived her death in my mind several times before it happened. because she overdosed 3 times. So those 3 times, I prepared myself mentally, I tried to, for that phone call one day, because she just don't want to do right. This is how I'm feeling. So that was my preparation for it. But I went through the grieving process with it because she was so young to me. The death of my husband was it was totally a different. This was so unexpected. We just had a baby. Death was not an option, and he was 52. Very healthy, very athletic, a clean eater. I mean, someone you really wouldn't think that this would happen to. But through his death, I had my son, and my son was my daughter. Those were my motivations, right? God gave me my baby boy. I need to be around for him. It's the best. My husband has given me many, many beautiful gifts, but my son was the best gift I feel he gave me, right? Because we didn't want children at first. I was older. I was in my 40s, right? What I want kids for. So dealing with his was different, and this is how therapy really, really helped me, because I was not suicidal, but it was the closest thought to suicide that I ever got.
Suicide is real. Yeah.
There was no plan. Okay, I'll make it a little bit deeper for y'all to understand, and I hope, please do not judge me, and I know this is the internet. But I had a problem with one of the celebrities that tried to kill herself after she was in a relationship with a married man and got pregnant.
I know who you're talking about.
Okay? I was hard. I was like, absolutely not. You got your whole family out here. You just had a baby. And I understand postpartum and stuff like this, but this is a little after. And I'm thinking, you trying to kill yourself? You really attempted to kill yourself over a relationship that wasn't healthy from the beginning. Now, after this situation, I had a lot more empathy for this person. I never attempted it, but the thought of not being here, I thought about it. And that's just very forthcoming. So I know that happens through grief also, of something so expected. When you have to, I didn't know who I was anymore afterwards. I was a mother, I was a wife, I loved my marriage. So now who am I after he's gone? So that's when therapy plays a bigger role. And I knew that I needed it, and I knew that I had to go. And that's why I was there 3 or 4 days a week, okay? Because these things, and I needed to be healthy for my son, and I refused to take medication, right? My biggest fear that I was gonna roll over on him and suffocate him, because now I got some Valium or something that's calming my anxiety, but I'm not being responsible for my son. So that's why therapy was also important every single day. So yeah, I allowed myself to forgive myself for disliking this person that I didn't know, but I really did not. I felt very strong about that. So now there's a different empathy towards that, and I get it when someone says that there is a low so low that you can have a thought that, everyone dies. Everybody. We all have that in common. We are not going to be here forever. Everyone dies. There's something we all got to do. And that's something I also had to deal with, because in my profession, I'm one of healing. I want to see people healthy. I want you living your best life. And having to realize that sometimes in those moments, that is their best life. Sorry about that for my little interruption. Thank you. All right. So now the next question was, did you feel pressure to move on? From your grief, right? Did anyone in the family tell you, like, okay, he's gone, get over it? Or what we gonna do to move past that?
I feel like it was myself, pressuring myself to move on.
Okay.
I feel like, in my mind, I can't sit and live in this forever. So it was like pressure from day one to just move on. From the moment I got the phone call that they had put the plug on my father, I remember one was on my way to work, got the phone call, turned around, went back home. I remember crying for a good 30 minutes. My sister called me, she was crying, which made me cry even more. But in that moment, it was the pressure. I gotta be there for everybody. I can't sit in my own grief while everyone else is grieving because I have to be there for them. And so it wasn't pressure so much out from outside pressure, it was more internal pressure.
Okay. What about you, Chris?
I would say over time I felt pressure, not in the beginning, but over the more time that goes by, like when the years go by, because you have friends and family that don't understand what you're going through. So you start to feel like that you weighing people down. You start to feel like you can even be pushing people away. So I've lost friends and everything, and because I isolated myself, because it's just that I never want to be a burden to anybody. I didn't feel like nobody understood what you can be going through with dealing with a new normal. Like everybody's life continues, but you're dealing with you reliving things over and over, and your life is changed. So I felt like people didn't understand. So I felt like even more recently, I've just feel the pressure to just, I would even say grieve lighter, like on days that on holidays and stuff. I don't try to I don't even show the emotion or anything. Even if I'm feeling it, you feel the pressure to just keep going because you don't want to, be a drag to anybody. And when you already lost people that didn't understand, you feel that pressure.
What's your aim? How did you deal? You come from a huge family. Thank you, Christy. You come from a huge family, and you've had many loved ones lost from age 8 up to now. What has your process been like? What did the coping, moving on, and who's your therapist?
Well, you all know my therapist, and his name is G.O.D. And that's what I was mentioning to my niece the other day. That's where I go to first. And then I go to family and friends. And then, of course, I work with so many mental health conditions, a plethora of different therapists. I have so many people that I can go to.
Yeah.
But at the same time, because what I teach every day is about, again, the reality of it, that we're all going to go, and that, but at the same token, teaching everybody to live as we most fundamentally can, thrive and live, but at the same token, know that one day we're going to reach that fork in the road as well. Then again, like you mentioned, what can people do to better cope? Like you're saying, have a support system, have family or friends that you can go to, and if not, then of course, seek clinical help. What happens with clinical help is that when over 2 weeks that you cannot get out of bed, that you're not eating food, you cannot go to work, you cannot go to school, that's when it becomes clinical, and that's when you need to become in touch with a professional. But before that happens, then reach out to an individual. Read some self-help books on death and dying, because everyone right up here, we deal with death and dying differently. We deal with everything else in life differently. So you got to know what's best for you. What are your coping skills that's going to help you? And that's what I teach, coping skills. And the main coping skill is to talk it out, Christy, to talk to someone, whether it's, again, your friend, your family, or God first, but talk to someone first. That's the number one coping skills when we deal with death and dying. Don't let it sink in all by yourself. Nothing in this life has to be dealt with by themselves. With so many of us around with each other that you don't have to carry it alone.
But everyone doesn't have a positive. Just pick the right person to talk to. That's all I'm gonna say. Be mindful of who you pick the right person to talk to.
Because everyone does not have your best interests at heart.
Yeah, not only that, they just, they may not. You got to know who and who not to talk to, because they could be struggling also, right? Yeah. And hurt people can hurt people. So you also want to be mindful of that. Thank you for sharing those copings. For my patients, I also recommend just finding a hobby that you love to do, and pour into that, right? Because it's such a benefit on so many different levels. It's physical, it's mental, it's social. You know, when you find something that you enjoy doing and you get out and do it, doesn't necessarily mean you have to be distracting yourself or like that. But I think finding a hobby that when you don't do it, you don't feel yourself. I think that's a great thing also to help with coping and self-care, right? I mean, we're teaching self-love and self-care and really trying to drive it home for each and every one of us. You know, and that hobby can be a part of that self-care, whatever that is. Like, I'm not saying like unhealthy shopping, not that, right? Like things we enjoy doing, but something that that affects your mental, your physical, and social activities. Moving on, I'll share something. My late husband has a huge family. They have a huge family, okay? And initially when I would go around, when I would leave them, I would be depressed for about 2 weeks. And it stopped making me come around as much as I wanted to. And they started to notice it. So one day I just had to tell them, every time I come around, y'all, oh my God, he looked like Schmuck. Like, you know, all of that and all the great memories and things that I love now and that I can handle emotionally, I couldn't handle those at first. So I would leave there, just now I'm depressed about what I lost all over again, right? And living in that. And when I shared that with them, and I was like, this has nothing to do with y'all. I just need for y'all to understand where I'm coming from, right? Because they put, you know, they're always doing something together, which I love so much about them, and staying connected and keeping my son aware and, you know, of things like that. So I used to avoid them in the beginning because I didn't want to go home and be depressed for weeks after leaving them. But once I spoke on it and I got it and I was brave enough to share that with them, it became so much easier to go around because then they could understand. And like you said, initially my family was the hugest. They were the biggest supporters. But then there were some that was a little unhealthy. But I knew that it came from a place of love and they were just trying to help and do the best they could do. That's what they could offer. So I didn't want to judge them because I knew that they just was trying to help. Yeah, they were trying to just, you know, because sometimes you just don't know what to say. You want to say something nice, but you don't know what that is for most people.
And sometimes people can only help from their level of understanding.
Yes, exactly. So you have to understand where that person is and meet them where they are, and don't be so judgy.
I think more people should definitely understand the 5 stages of grief. I think that would help them in coping skills and coping mechanism about grief. And I don't mean to be cynical when I say this, you all, but a lot of times we talk about death and I listen to people all the time. That's what I do. And it was like, you didn't understand that we were going to get to this point in our life, that they were going to die. Sometimes you hear a person talking about a 90-year-old who's like, wait a minute now, they're 95, reaching 100. How long do we expect? We are going to die, you all. And I think once we understand that process, a part of life, I think we're better to understand that death when it actually happens. I don't care if it's immediate death. I don't care if it's something you just was shocked with. I was in Japan 2 days to come home before I found out I was 24 years old, and my father died 2 days before I was to come home after staying in Japan for 3 years. But my family embraced me and told me, first they wasn't going to tell me, but they told me. They made sure that they reached out to the command to tell me that my father had died. And of course, I had to deal with it. I had to face that reality. Yes, I would have, we being the youngest again, that was one of the cons of being in a large family, to being the youngest, that my brothers and sisters dealt with my father much longer than I did, but because I was the youngest. But I had to understand that. My family helped me understand that. But I think society as a whole, once we understand that one day we are going to reach this pivotal moment in our life, that I think we'll be able to cope with it better.
And one thing I would say is that I wish people understood that grief never dies. The person may die, but the grief never dies. Grief never dies, and it hits you at any given time, moment of the day. It don't matter if you just woke up or you didn't have a rough day at work, it will hit you. And it can hit you from watching a video, a movie, or just anything. I know, like for me, for example, I could be scrolling on Instagram, TikTok, or whatever, and I see a father and son moment, and I instantly cry because I know that's something I would never experience again with my father. And that's something I don't think people understand, that just because you have moved on from the situation doesn't mean that that grief that you had has gone.
I heard a saying when I went to one of the cancer support groups, is that grief, and they gave me the book, grief is the last act of caring. And when you understand that there's five, that the word grief encompasses, the concept is 5 different steps, right? And those steps are on a continuum. So initially, the way I denied in the beginning, maybe my denial now may look a little different, right? But do I still deny things? Is that what I have to be made aware of also, right? I still could be, because the process of it could be forever. Grieving, that could be a very long process. So I hope that people take that away. So, Dr. Wellington, what is something that you wish people understood, and someone that is newly grieving, what is something that you want them to take away, and what's an advice that you could give this person?
I think that's a great question. I think we hear it all the time on social media sometimes when we talk about how you treat people. Every day about your lives. We do not know the day or the hour. Love your family, love your friends, love your fellow man, because one day they're going to be gone, whether you like them or not. You know, so I think if people could really, truly understand that concept in their daily lives, that we are all in this together, and that the more we love our individuals and not hate for whomever you are, I think we can understand it better that, hey, I'm going to live my life. My motto in life is to live my life, enjoy my life, treat everybody kind, and because one day I'm going to leave this earth. And I think once everybody understands that concept, I think we'll be in a better place.
Time waits for no one.
What advice can you share or give to those who have fractured relationships with elderly parents?
My advice is to fix it. And I'm speaking from personal experience. Like I said, me and my father, we didn't have the best relationship. My father wasn't really in my life like I would have liked him to be. And down to when my mother called me and told me that my father was in the hospital, I said, so what am I supposed to do? He'll be fine. He's gonna be all right. He's been in the hospital before. He done made it out. He's gonna make it out. I was angry. And it's because of the relationship that we didn't have. And as an adult, realizing that he's no longer here, me thinking that time was on my side. We'll fix it at some point. We got all these years, and we don't now. So I think fixing the relationship with your parents, no matter how fractured, it's important, because the way I felt when I found out that he died is something I don't wish on my worst enemy. It's something that I can't even still to this day fathom. And I think that when you hold so much hostility and anger towards that parent because of what they didn't do, what they should have done, it stops that relationship from maturing from that point. I personally, our parents were kids too. They're human too. They have feelings, emotions, they go through things, and we sometimes forget that as the child. So I don't know what my father was experiencing when him and my mother didn't work out and why he chose not to be a part of my life. But I can't hold that. I should not have held that against him. In my adulthood, I should have tried to work on that relationship like he wanted to. But I was just so angry and just, I don't want to talk to you. I don't want to spend no time with you. I don't want to be around. And I wish if I had a time machine, I could go back and just live all of those moments that he wanted to have with me as an adult. And I don't have them. So if you are experiencing anger towards your parents for whatever reason, the next second is not promised to you or them. So fix it now, work on that relationship now, so that when they do pass, you don't have the what if, the woulda, shoulda, coulda. You won't have those because you did the work, and now y'all had a better relationship when they did pass.
What's your input?
I think that's exactly head on. You have to focus on severing whatever differences you have with your adult parents. Like you said, they were adolescents at one point, and no one is perfect.
No.
No one on this earth is perfect. So again, one day they're gonna go, so treat them, love on them as much as you possibly can, and help them as much as you possibly can.
And I agree. So I went through a little bit of that too, right?
Mm-hmm.
And I just realized that she was an awesome mother. She was the best mother that she could be, and that's how I look at it. And I love her to death for that. However, there are some relationships that the other party may not want it, right? And this is when it becomes a challenge. When if the parents don't want it, or the child doesn't want it, or they're not there yet, right? And you can't force them to be there. They have to be there. That's when I recommend therapy, once again. Being able to accept the things that we have no control over and really being good in that moment, right? Because you have no control.
Well,
So you can't make a person want to have a relationship with you.
But leave space for them.
Thank you. That's what you want, right? So you have to be able to accept the fact that's not where they are, and whenever they're ready to be there, don't get in your ego and be like, oh, because she's ready, I need to be ready. I don't want to. No,
Leave space
no.
open.
If that's something that the person really wants, because sometimes the other party may not want that, right? And I've seen that before too. So you got to be good where you are and leave space for the opportunity to present itself. This was a great panel. I really do appreciate everyone and being so honest and vulnerable while you're up here, including myself. I try to be stoic. But I got the good Dr. Wellington here. He done wrote down all my diagnoses. I guess he's gonna call me. He's gonna call me later. But I just want to thank everyone. I want to thank you for your time. I want to thank you for listening. If there was something that we said that resonates with you, if you're looking and you need to be connected with a therapist, you can DM. There's going to be information for DMs and numbers that you can reach out to and get those resources available here. Once again, thank you. Thank you for spending time with us this Saturday and allowing us to share our stories with you and what we've done to help get us to this point right here. Not saying that it was the best route to go. That was the perfect route to go, but we're here now. So I think we're in a better place than we were then. And I hope that something we have said will put you in a better place also.
thank you, Doc. You did great.
Thank you, Dr.
Cool.